day. But today I'm going to demonstrate how I would perform an intramuscular vaccination or injection, or whatever you want to call it. So I'm going to be choosing to do it on the neck because I just found it a bit easier than behind. You don't want to get the fixed and whatnot. But the area that you want to do it, just like a big triangle, so I'd say about there. You know, use your hands to mark out. This big muscle right here is really nice. So I am not going to use an actual needle because that's a bit hazardous, and he doesn't need any injections or anything like that. But I do have a syringe. Obviously you'd use a clean one, but I don't want to keep using syringes and having to throw them away when we actually need them for something. So pretend this is my needle. You would just have like a basic plunger like this, and then you take a needle, attach it to that, and do not do anything until you are ready. So do not take off the cap until you are ready to put it right in, because as soon as you take off the cap, it'll be exposed to oxygen and any bacteria that's in the air, and that can cause infections, and no one wants that. So I'm just going to be using this and demonstrate what I would do. So obviously you would have whatever medicine or antibiotics that you would need in there. Isn't that fine? Yeah. So I would come up to his neck and find the spot that I want to use, and I pinch a little bit so I can really get like under the skin, and then slowly and very gently insert the needle and let go, and very slowly inject whatever you're injecting, and then pull it out straight out so it doesn't break, and then rub the area down so it feels all nice and good afterwards.
And once again, I forgot to mention how you would, excuse me, sorry, dispose of waste properly. Oh, I'm so sorry. With needles, you would put the cap back on and make sure you put it in a sharp spin, which is should be away from any other horses or people or anything like that, to reduce any hazards in the area. And make sure you don't throw them away just in a regular bin, because once again that's very hazardous. And I wasn't wearing gloves in this video because I didn't want to waste any, but when doing an intramuscular injection it would be beneficial to wear gloves, again, so you don't cause any infections in the horse, or you don't get any infections from them onto your hands and into cuts, and so on and so on.